It's my pleasure to introduce our third speaker, Dr. Mason Marks. Dr. Marks holds both an MD and a JD, and he's an assistant professor of law at Gonzaga University, and also currently the Edmund J. Safra Petrie Flom Center Joint Fellow in Residence at Harvard University and an affiliated fellow in the Information Society Project at Yale Law School, and was previously a research scholar at NYU Law School's Information Law Institute. Dr. Marks' research focuses on health law, data privacy, technology law, and FDA regulation. He is particularly interested in the application of artificial intelligence to medical decision-making and how these new technologies may disrupt the flow of health information. He's published very widely, including a forthcoming article on algorithmic disability discrimination in a Cambridge University edited volume. And his work is national as well. It's been cited by all the major outlets and even covered on NPR's All Things Considered. So they've all been able to see his research, and now we get to see it too. Thanks, Dr. Marks, for being with us and sharing your knowledge. The floor is yours.
Thank you so much, Francis. Good afternoon, everyone. I'm going to talk about artificial intelligence-based suicide predictions and bias. And just as a little background, the United States is facing several mental health crises. Since 1999, suicide rates have increased. You can see from the CDC data, they've gone up rather steadily over the past 20 years. And in 2018, they produced nearly 50,000 deaths due to suicide. There's also been a simultaneous increase in drug overdose deaths, which is even more striking. Since 1999, the rate has increased about 350%, and there were nearly 71,000 deaths in 2019. It's not surprising that the COVID-19 pandemic has made these trends even worse, and we're seeing increased rates of depression, anxiety, drug use, and suicidal thoughts. These are some of the headlines that reflect these trends. They've popped up in the past 6 or 7 months. And of course, we need to do something to reverse these trends. Many people believe technology is the answer, and it could be part of the solution. In a time when it's very difficult to make an appointment with a healthcare provider due to social distancing requirements, many people are turning to telehealth to receive mental health care, and apps like BetterHelp and Talkspace are becoming quite popular. People are also using things like meditation apps such as Headspace to alleviate anxiety. But I'm going to talk about artificial intelligence and its role in addressing the mental health crisis. There are some within the healthcare system, usually academics, who are researching how AI can be used to infer mental health conditions such as suicidal ideation from medical records, for example, or from behavior on social media. And some examples of groups in this camp include researchers at Vanderbilt Medical Center, Harvard Medical School, and the University of Pennsylvania. These groups are investigating in a responsible and methodical way how AI can infer or predict mental health conditions. And they're doing it in a research context, subject to IRB approval. Now, IRBs may not be perfect in they might not yet fully understand how to protect research subjects in studies involving AI, but at least there are some safeguards in place. On the other hand, there's another group of entities applying AI to make mental health inferences, and they're private companies. Unlike the researchers who are being relatively careful and methodical by limiting their AI to research applications, many companies have blown right past the research stage, and they've released their suicide prediction software into the marketplace, and Facebook is the most prominent example. Facebook uses AI to scan all user-generated content uploaded to its site in at least 6 different languages used around the world. Another example is Crisis Text Line, which also operates in the United Kingdom under the name Shout. It's a text-based crisis counseling service marketed to teens and adults, young adults, but it likely also serves many children. Objective Zero is a smartphone app. It's directed primarily to veterans, and its goal is to reduce the suicide rate to 0. These last 3 companies market their AI to schools and school districts, and they claim that they can use AI to predict suicide, substance use disorders, sexual behavior, and potentially violence, with the goal of reducing school violence and potentially events like school shootings. I think I'm going to ditch my clicker and just say, next slide, please. Thank you. I want to focus in on Facebook's system for a moment. This is an image provided by the company describing its AI suicide prediction system. And this picture contains nearly all the information that we have about the system, which is not very much. So unlike the detailed explanations provided by academic researchers through their scientific publications, what we know about Facebook's system is largely limited to this literal black box, which is actually a pretty good metaphor for the actual system. Facebook's AI analyzes the content of what users type into the social media platform. And in this case, the example provided is the word goodbye, which could be construed as a statement indicating a plan to attempt suicide or suicidal ideation. But the words analyzed need not have any apparent connection to suicidal ideation. They could be seemingly random words and phrases. The AI will still analyze them, and that's just the power of deep phenotyping. The AI also analyzes the comments made by other Facebook users in response to the primary statement. In this case, the example used is, "Where are you?" The AI also reportedly takes into account the time of day these posts are made and the day of the week they're submitted. The output of this AI is a suicide risk score ranging from 0 to 1. And according to Facebook, scores closer to 1 are said to reflect the highest risk of suicide. And if the score is high enough, but we don't know exactly how high because we don't have any information about it, the case will get escalated up to Facebook's community operations team, and they may contact police and send them to the user's home to perform what Facebook calls a wellness check. Now, that may sound like a good idea. Obviously, preventing suicide is very important. The problem is that these systems are unscientific. Their mechanisms are opaque. There's no transparency. There's no oversight, no regulation, and no standards to ensure user safety. We have so little information that these systems could even be making things worse, potentially worse for some groups and members of society than for others. Next slide, please. I want to return to the companies that market their products to school districts. Whereas Facebook monitors suicide risk only on its websites, so Facebook and Instagram, for example, Gaggle, GoGuardian, and Bark monitor the behavior of millions of students on dozens of platforms and applications across the internet. And in this algorithmic age in which we find ourselves, students are increasingly communicating and completing homework online through devices and applications provided by schools through contracts with tech companies. During the pandemic, many students do everything online, including receiving instruction, and their behavior is subject to continuous total surveillance by tech companies and their artificial intelligence. Next slide, please. These are just some of the applications and services that Bark claims to monitor student behavior through. Unlike its competitors, Bark offers its services for free, just like Facebook. So schools can use it to predict suicidal behavior in students without paying anything. And you may have heard the saying, if the product is free, you are the product. And that's often true. And that should be a red flag that companies might be profiting from the information. And in this case, it's sensitive information pertaining to minors and their mental health that may be harvested. Other companies profit from suicide predictions. Crisis Text Line, which I mentioned earlier, takes what it learns using AI to infer suicide in teens and children, and it funnels that into a for-profit entity called Loris, which sells services to corporations to help them infer the emotions of consumers when they call for customer support. So the next time you call AT&T or Comcast, AI developed by inferring suicidal behavior in teens and children could be used to determine whether you were angry or satisfied with your cable service. And I'll leave you to decide whether that practice is ethical. Next slide, please. Next, I want to focus on some of the interventions that are triggered by these platforms. I mentioned wellness checks, which Facebook has initiated thousands of times around the world. These interventions are initiated by the platform by contacting 911, for example. And when police respond, they may enter a user's home without a search warrant. There's something called the exigent circumstances exception to the Fourth Amendment's warrant requirement. And when someone's life could potentially be in danger, that requirement for a warrant can be waived. That user could be detained, hospitalized, and medicated against their will. And there is some evidence to suggest that involuntary hospitalization and forced medication can actually increase the risk of suicide. And that may be particularly true if after release from a hospital, a person lacks a support structure in the community. So for example, releasing a person into a situation where there might be abuse or neglect, that could be particularly problematic. And the experience can be traumatic, leading to stigmatization by many parties, including healthcare providers who are not immune from bias. Studies have shown that healthcare providers can be biased against people with mental health conditions and substance use disorders. Next slide, please. Speaking of bias, I think it's important that we take a step back and we take an expansive view of these prediction systems, which have many interconnected components. And there are many points in this chain at which bias can be introduced, including Facebook's human moderators who receive a suicide prediction and determine how to react. We don't know anything about their procedures and what standards they use to determine when police should become involved. If police are involved, they may treat certain individuals differently. There are numerous examples in which people with disabilities and racial minorities have been shot and killed by police during wellness checks. School officials are another potential source of bias. We don't know how they might respond to suicide alerts and whether they might treat some individuals differently in response to those alerts. I mentioned healthcare providers earlier. I also list algorithmic decision makers here because the data generated by suicide prediction software can be recycled and have secondary uses where the information is used for other purposes, such as targeted advertising, job applicant screening, or tenant screening by landlords and rental companies. These groups could potentially get their hands on suicide predictions and make biased, discriminatory decisions based on that information. Just to reiterate, unlike suicide research that's done within the medical community and subject to some safeguards, albeit imperfect safeguards, suicide predictions in the commercial setting are unregulated and the data can be reused, often without legal repercussions. Next slide, please. I want to end with some general recommendations. We need to open up these black boxes of Facebook and other platforms' suicide prediction software. They need to be made available for public scrutiny, and this should be done immediately. When platforms hand off their predictions to law enforcement, they often view that as the end of their responsibility. But as I mentioned, we need to view these systems, these services as complex systems. And Facebook initiates that process. It should be held accountable for consequences at later stages in the process, especially when it refuses to open up its platform and be more transparent. It could actually be causing significant harm. There must be testing for safety and efficacy. There currently is none, at least none that's publicly available. Platforms should also respect user autonomy, and suicide screening should be strictly voluntary. So you can imagine, for example, Facebook providing users with a menu of options. One of them could be, would you like to be monitored for suicide risk or substance use disorder risk? And it could provide users with options for how they would like Facebook to respond. They could respond by notifying a family member, a friend, perhaps a primary care physician, or some other healthcare provider. To be fair, some of the platforms I mentioned in the educational context, they will notify family members instead of police, but users are not given any kind of control over that, over who is contacted, and that needs to change. I also argue that we need to emphasize soft touch interventions, and those are some examples, perhaps notifying a healthcare provider or having a social worker contact the user. First responders, including police, should receive special training in how to de-escalate mental health crises. Right now, this constitutes only a very small fraction of the training police receive, with most of their time going to weapons training and tactics. Finally, I argue that the FDA should regulate suicide prediction software, including the platforms operated by Facebook, Crisis Text Line, GoGuardian, and its competitors. The FDA already regulates software as a medical device, so this would not be a significant change or burden on the agency. Thank you very much. I'm looking forward to our discussion.